welcome. Today we are going to talk about how to perform a type of injection called an ID or an intradermal injection. Now these types of injections, if you've watched my how to administer medications video, these type of injections are done just underneath the skin, and they're done for a variety of reasons. Probably most commonly to do a PPD or a TB skin test. Okay, so just to get started, let's first talk about the supplies that we'll need. We will need alcohol prep pads, gloves, of course, a 1 milliliter or 1 cc syringe, a small needle. What I have available are 25 gauge 1-inch needles. More commonly for PPDs especially, you use a 25 to 27 gauge needle, and they're usually about 1/2 inch, possibly even 5/8 of an inch. This is what I have available today. But many, just so you're aware, many of the syringes and needles that are used specifically for TB skin tests actually will come already assembled and together. But this is what I have to demonstrate with, so that is what we will be using today just to get the technique down. I have a vial of my, this is fake, of course. Well, it's not fake, it's saline, but you would have your vial of PPD, which stands for Purified Protein Derivative. Now, I have a larger vial here. This would have several doses in it. PPDs can come many ways. They can come either in a multiple dose vial like that, or they can come in single dose vials. Single dose are super tiny because we will only be using 0.1 milliliter to inject. However, more commonly you will see the vials that come that are probably 1 ml, so there's 10 separate doses in there, and they are refrigerated, so you need to make sure that you put them right back in the refrigerator after you use them. Okay, and then of course, this is not something you would need in the field, obviously, but I have my patient. This is my patient today. Okay, all right, so just to get started here, the first thing that we do when doing a TB test, now intradermal injections can also be done for other reasons like allergy tests, not testing, but allergy injections and things like that. Sometimes allergy testing if they do skin tests, but most commonly as a medical assistant, you'll be doing these for TB testing. So, just some things to understand prior to even doing any of this, drawing it up, preparing it, getting ready for it. Most offices, and this will depend on your specific clinic or office, will have a questionnaire that the patient either reads through and checks off and signs, or you can ask the questions. I actually prefer to do that. It's a little quicker sometimes. But they are questions such as allergy type questions. Have you ever had a PPD skin test before? Were you born outside of the United States? Now, this is an important question because if the patient was born outside the United States, it's very important to understand which country they were born in, because many countries outside of the US actually have a tuberculosis vaccine. We do not here in the US. We do not. It's called a BCG. And the countries that do have them usually will vaccinate their population fairly young. So even if your patient had come to the U.S. as a child, chances are they had that vaccine. And if they've had the vaccine, then they will more than likely, almost 99% of the time, they will test positive on a skin test. And that will happen their entire life. So there's really no point in doing the skin test because you know it's going to come back positive, which means, or more than likely will come back positive, which means then they would have to go to another step, which is either a blood test called a quantiferin, or get a chest x-ray to rule out tuberculosis at that point. Now, when they come back positive because they've had the vaccine and maybe they didn't know, so you went ahead and did it anyway, they shouldn't panic about that. It just means that the PPD is reacting to what's in their system from having the vaccine is all. It doesn't mean they're positive for TB or anything like that. So you ask them those questions. Another very important question too is to ask them if they can and are able to return to your clinic within 48 to 72 hours. Because once this test is placed, it then needs to be read in 48 to 72 hours. Anytime beyond that nullifies the results. So if they say they can't come back, excuse me, in 48 to 72 hours, again, no point in doing the test. You'll just be wasting your time, their time, the PPD, their money, everything, because they would just have to get it redone then. At that point, reschedule them to come back at a time where they can have it done and then return in that time frame. For that reason, there's a lot of reasons we don't do the PPD. If it is a Thursday, why would you place the PPD on a Thursday when 48 to 72 hours is Saturday or Sunday and your clinic's not open? So we generally don't do those. A lot of places won't do them on Fridays either because people are less likely to return on the Monday, which is the absolute edge of that window. But make sure that all of those are in place. They haven't had the vaccine, they can return. And here's why. If they say no or yes, or if they answer, contraindicating any of this, if you've already drawn up the medication, you've now wasted a dose. And trust me, stuff's not cheap. Okay, so make sure you ask all of these things prior to drawing up the dose that you're going to give. All right, so once that is all out of the way and we've established that no prior positive tests, no vaccine, can come back in 48 to 72 hours. Now we're ready to go. And we first then want to take a look at the arm. Okay, so we want to take a look at the patient's arm before we do anything. Where this is to be placed is on the inner forearm. Okay, about 2 to 3 fingers. My fingers are kind of wide, so I say 2. If you have thinner fingers, 3. 2 to 3 fingers from the wrist. 2 to 3 fingers from the antecubital. So anywhere in this area, okay? And you can go a little to the side here, a little to the side here, it's fine. Now I am a good example for this because I'm tattooed. You want to try to avoid placing in a tattooed area, not because it's going to bother the tattoo. That debate's been raging on for years. But just because you need to be able to see where you've placed it fairly easily. And if you have, especially like me, very dark tattoos like this, it's really difficult to see. So for someone like me, I would go more on this arm, maybe in between some of my tattoos. Now, there's going to be instances where you just can't avoid it, which is fine. In that case, my recommendation is to go for the lightest area, or if you do have just a tiny patch of skin that's not inked, you can do that. So you want to make sure that the area is also free of any scarring, current injury, moles, really hairy areas, or also veiny areas. Okay, you are going just under the skin, but again, we want a nice clean piece of real estate, not something that there might be some issues with dealing with. Okay, so once you have determined the spot you are going to go into, you're going to go ahead and apply your gloves. Now, policy will dictate where you draw this up in your office. Many offices want you to draw everything up in a medication room, which is absolutely fine, and then you can just take it on a tray to the room. I have always gone ahead and brought these into the room with me and drawn up right there, and I'll tell you why here in a moment. But once you have everything set and ready to go, you will go ahead, if it is not already popped, you'll pop your top off of your vial. I do have a video on how to draw up medications safely. If you haven't watched that, you might want to watch that. But once we do that, we're going to go ahead. Now I go ahead and I just open up my packages. I don't take anything out, but I just open everything up so I'm not fighting with it, because that is something I do well, is fight with packages. We're going to go ahead and, if you've watched my drawing up medication video, you will know that whether it's a brand new vial or not, we always clean the top off of the vial with alcohol. So take an alcohol swab, go ahead and clean that. Okay, set that off to the side for disposal. Then we're going to go ahead. Now, again, like I said, many of your TB syringes are already, the needle's already attached to the syringe. But in my case, I don't have a TB one available. So I'm just going to go ahead and attach that. And this is, just so you know, this is a little bit longer of a needle than you would normally use. But for demonstration purposes, it will work. If your needle has a safety device such as this on it, you want to go ahead and pull that back before you uncap. Okay. Now, here's why I say take it in if policy allows. Of course, if it doesn't, just do what your clinic's policy wants you to do. But why I say draw this up right next to the patient before you do it is that once you draw up, this is one of those instances where we draw up with the same needle that we give with 9 times out of 10. So that being said, you don't want to have to try and recap a needle. It's very dangerous. I avoid that at all costs, but I will show you in this instance how to recap a needle if you need to. Now, please understand you never, ever, ever, ever recap a used needle. In this particular instance, especially if you have a needle and syringe that are attached without being able to remove the needle, you're recapping a clean needle, meaning it has not been in a person yet, okay? So the very worst that could happen at that point, if you accidentally stick yourself, is that you stick yourself, causing injury, and maybe get a little of the PPD on you, which really is not going to harm anything. It would be a problem though. So we're going to go ahead and we are going to uncap our needle. And again, if you've watched my video, I call this chicken wing, how to take the cap off. Okay, sit the cap down. We are going to, for a TB test, it is 0.1. Let me show you that, 0.1 mLs or cc's. So I'm just going to go ahead and draw the air back for that. Always hold your vial on a flat surface. Go ahead and put your needle in, inject your air, turn it up, and then we will go ahead and draw that 0.1 up. I always draw just a little beyond the 0.1. Put it back down, bring it up, just to allow for bubbles or anything like that, and so that we can push a little bit of the air out without losing any of our medication, okay? So I've got that drawn up now to 0.1, okay? If I was right by the patient and I had already cleaned the area and all that good stuff, I could just go ahead and go right now, okay? Not having to recap or anything. If I am not in that situation, then what I would want to do is go ahead and recap the needle. I say that very cautiously. You never want to recap a needle this way. If you have poor depth perception, you will stick yourself. So in this instance, if you absolutely positively have to do it, what you want to do is have the cap laying on the hard surface. Take this, don't touch the needle to the surface, obviously, but just scoop up your cap and then you can put it back on like that, okay? That will alleviate or eliminate any possibility of you sticking yourself, okay? So if you did have to, like I said, take it in with you, that can work, okay. So now that we have our patient, and this is our patient for all intents and purposes, Here is our patient. Okay, let me put his arm here. All right, and once we have the area in which we want to, let me pull this back just a little, where we want to go ahead and place this PPD, we're going to go ahead and take another alcohol swab. When we do any cleaning, whether it's for venipuncture, injection, anything like that, we put it down nice big circles to push the microorganisms that we are trying to get rid of away, okay? We, of course, let that dry because we don't want to push alcohol into an open wound. That is no fun. Kind of stings a little bit, okay? Once that has dried, and please don't do this and don't blow on it. I'm talking to the parents out there because that's what you do to your kids, right? Once that has dried, and I know it looks not dry on here because it's rubber, you're going to take your syringe, and you always want the bevel or the opening of the needle to be facing up, okay? Now, with this type of safety device, the safety device is always on the side of the bevel. So if the safety device is on top, you know your bevel is up, okay? If you have really bad eyes like me, it's sometimes very difficult, especially on these very small, tiny needles, to see where the bevel is. So once we have that, we're gonna get ready to actually inject. Now, some videos you'll see, it'll show them pulling the skin taut like this, okay? You do want to pull the skin taut or tight, because if you don't, especially on older individuals, the needle will push the skin and it'll make it very difficult to get it underneath. So you do want to pull it taut, but don't do this because then you will be injecting towards your hand. And if that patient should jump or anything like that, you could very easily stick yourself, okay? So I use my thumb. You could use your finger if you want. I always just get to the side of where I'm going to go and I pull this way. Okay, just pull tight like this because then I'm not in my own way. This is a very shallow angle that you have to go in at. So if you were to pull this way, then you would be on top of your own thumb and that would make you have to make a bigger angle and it's not going to work out that way. So I just pull to the side, okay? In other videos that you will see of me or have seen of me, I always talk about not doing using two hands to inject. This is the only injection that two hands is necessary and acceptable, okay, in my mind anyway. So once you're ready to go, you're going to uncap your needle. We have the bevel up. Now, you're going to hold your syringe like this, okay? You don't want to hold like this, like when you're drawing blood. You want to hold like this because, again, very shallow angle. We're going just under the skin. So you don't want your fingers getting in the way and causing the angle to have to go up, okay? So hold it like this, okay? Then what you're going to do after you've pulled your skin taut is you are literally going to put this just under the skin, okay? Just under. Oftentimes you will be able to see, especially in very light-skinned individuals, you will actually be able to see the needle, kind of a shadow of it underneath the skin, okay? Once you have gone just past the bevel, gently let go of the skin, reach back, and push very slowly into the skin. Now, once you have done that, you will see, unfortunately on this particular model, I can't get it to do it because it's rubber, you will see a bubble form. So let me put that back in there and I'll show you exactly where that forms. You'll see a bubble form just around where the needle is in the skin, okay? And that bubble is the solution that you have just injected. It actually, you're so shallow and you're so superficial to everything else that solution actually forms a bubble underneath the skin. It raises the skin up. This is called a wheal, and not wheel like a wheel on your car. It's W-H-E-A-L. So on any of your exams, if you're asked how to spell that properly, it's W-H-E-A-L. And once you have that wheel, you know that you have done a good job, okay? You will pull the needle out, go ahead and safety it. And again, if you've watched my other videos, I don't like to use my thumb to safety these. I think it's dangerous. Get the edge of the table, edge of a hard surface, and you go ahead and safety like that and dispose of it, okay? There's no lice right here for now. What you don't want to do at this point is rub it. You know, other types of injections will take a gauze and rub. You don't want to do that. You absolutely don't want to put a Band-Aid over it or anything. You don't want to do anything that will disturb that area. And at this point, you are done with the injection. Okay, so now you've performed your ID injection. You've done your, in this case, PPD. What you tell your patient at this point for aftercare instructions is don't mess with it. Don't scratch it. It might get a little itchy. Don't scratch it. Don't rub it. They can go ahead and wash the area. That's fine. Just don't scrub it. Be gentle. Don't put lotions on, creams, anything like that for the next 48 to 72 hours in between the time of the placement and when you read it, okay? Reinforce when they are coming back. Make an appointment if you have to for them to come back to have that read. And then go ahead and ask them if they have any questions, okay? Do let them know they might see some minor irritation, maybe even a little redness. That doesn't indicate that it's positive necessarily. So just let them know what to look for. And if they do have any questions, they can call the office. Otherwise, we'll see them back in that 48 to 72 hours to have it read. And then the way you would document this is you would document that you administered PPD, 0.1 ml or cc, however you document, which forearm you administered it in, right or left, the name of the manufacturer of the PPD, the lot number, the expiration date, and then I always throw in there that the patient reacted well, or tolerated well, is how I usually put it, and was educated on aftercare and will return in 48 to 72 hours. And then you're done. Now, when they do come back, what you're looking for when you read it, if you're the one reading it, is what we call induration. And this is, again, just for PPD. We're looking for what's called induration, which is a hard lump, a firm lump, okay? That area that you place the PPD may be red. It may look irritated, but if there is no firm lump underneath the skin, that is not positive, okay? And we as medical assistants are not It's not in our scope of practice to determine positive or negative. That's up to the provider. But if they do have an induration at all, what you want to do is just find the edges of that lump, mark it with a skin marker, and we always have skin markers, just a little dot on each edge from side to side. And then you will have a millimeter ruler at your disposal that you can then measure that induration from that dot to that dot, so edge to edge. And then you will document that. 5 millimeters of induration, 10 millimeters of induration. I've seen up to 17. So that's huge. But if there is no induration, then what you document is 0 millimeters of induration. Again, we don't mark positive or negative. The results are given just in the millimeters of induration. Okay? Now, if there is a positive, well, not a positive because that's not up to us. If there is at all induration, then you would want to show that to your provider, and they will then make the determination of whether we're going to draw blood on them to confirm or whether we're going to send them out to have a chest x-ray done. Okay? All right. So I hope this has been helpful for you. I hope you've enjoyed this video. If you have, please drop a like and subscribe, and check out my other videos too. I have several on how to administer medications, and I will be coming back with some for other types of injections too. But until then, take care, and we'll see you next time.